All right, so question number 1. When assigning clients on a medical surgical floor to a RN and LPN/VN, it is best for the charge nurse to assign which client to the LPN/VN? A child with bacterial meningitis with recent seizures. B, an older adult client with pneumonia and viral meningitis. C, a female client in isolation with meningococcal meningitis. And D, a male client 1 day post-op after drainage of a brain abscess. All right, so we got a lot of clients going on. Now remember, big thing, I'm just gonna write this on this side as a reminder, the 1, 2, 3, that's our 2 to N3 step. We always have to be thinking about what is the question asking us, right? What's the problem, right? And what's the solution? And thinking through that 2 to N3 step, using that model, that method is what's gonna help us to ensure that we are consistently applying our critical thinking skills to each question. So looking at this, right, we know our ask, it's just asking us who's best for the LPN, right? And the problem is we're the charge nurse and we're assigning these clients to the LPN on this med-surg floor. So now we have to find that solution. Remember, one thing that you're gonna hear me say a ton, outcomes, right? And you'll see that too in our other lessons when we talk about the 3-step. We talk about constantly thinking about outcomes, right? Constantly stretching out our thoughts. So when we have a question like this, a delegation question, asking us who do we give to the LPN, here's where we can use our AAT tool, age, acuity, and time. And this really is just a kind of a guiding tool for us that helps us to determine and to think through who's a good patient for the LPN here. So we know that we have to consider age, we have to consider acuity, and we have to consider time. I won't get into it. There's a lesson for that. So let's just work our way through these options and let's talk about it in that language, right? So we'll start with D and work our way up. D says, a male client 1 day post-op after drainage of a brain abscess. So there's no age factor in here, which is fine. We know that's okay. We'll just skip through it. I do see a time factor. 1 day is called out. And acuity, well, yeah, they had a brain abscess that was drained. Remember acuity, right? When we are looking for that in our clients, all that means is what's going on with them. What's going on with them? It's up to us to determine what's the acuity there. Is that high acuity, low acuity? Meaning, is it stable, unstable? And remember that, right? So here we are. We've got that 1 day post-op. That's within our 24-hour period time frame. And this is what we're working with. This is the problem with our patient. Now we have to think, is this stable or is this unstable? Is this high acuity or low acuity? And anytime we use that language, we know that means we're just asking, is this predictable or not, right? If whatever is happening to our client is not predictable, you cannot clearly predict that trajectory, what those outcomes are gonna be, that's not a stable client. But if whatever is going on with the client, you can predict that trajectory, you can clearly predict those outcomes, well, that's a stable client then, and it's safe to give to the LPN. But let's take a look at this. A brain abscess that was drained 24 hours ago, so that's within our sweet spot of, hey, pay attention to that. Is this predictable? Can you clearly predict what's gonna happen next to the client? Do you know how this is gonna go for this guy? No. Right? No. Drainage of a brain abscess 24 hours ago, this is high acuity, not stable, right? We don't know how this is gonna go. He could have bleeding, increased ICP, seizures, become septic. This could be fatal, who knows? We can't predict that. So because we can't clearly say, well, this is the outcome that we're predicting, that's not a stable client. So we'll do the same thing with C, a female client in isolation with meningococcal meningitis. No age, right? No time, that's fine. But of course, everyone has something going on with them, and that's how we determine the acuity. So she's got meningococcal meningitis. What type of meningitis is that? Is that viral, bacterial, fungal, right? What is it? Bacterial, that's right. Bacterial meningitis. Is this high acuity or low acuity? Meaning, is this stable or unstable? Can you predict how this is going to go for the client. No, good job. Bacterial meningitis is high acuity. Consider what's the care around that? What are the outcomes with that, right? The client we know is in isolation. We're thinking, well, we know you're going to get IV antibiotics, frequent neuro checks, could become septic as well, right? Could have increased ICP, seizure activity. This could be fatal. We cannot predict the outcome for this client. And since it's not predictable, then it's not stable. So now we have A and B, a child with bacterial meningitis with recent seizures, and an older adult client with pneumonia and viral meningitis. So funny, they're both have an age present, right? They're both either the child or the adult, which is our little red flag we like to pay attention to. But very different things going on, very different acuity levels. So bacterial meningitis with recent seizures. Do we want to give that to the LPN? Is that a stable client? Nah. But B, an older adult client with pneumonia and viral meningitis. Well, that sounds okay. Pneumonia and viral meningitis, both viral infections, right? When we think about a viral infection versus a bacterial infection as far as acuity is concerned and stability, viral infections are so much more predictable, stable in that way when compared to bacteria. Why? Think about what we do for viral infections. Symptomatic care, right? Symptomatic management, making sure that our clients are comfortable and we let this run its course and we can predict how that outcome will go. So B is the correct answer here. This is our most stable client, most appropriate for the LPN. Good job on that. Now, one thing I want to call out with this particular question, this question would belong to the category of management of care, right? And so if you're ever a student of mine, you've heard me say this before, management of care is a big category, right? Like a big piece of the pie, the NCLEX pool pie of questions, if you will. And so that's important because it's going to be really important for all of us, right? No matter what our exam looks like, it's all going to be different, but it's going to be super important for all of us to feel comfortable with delegating appropriately, with prioritizing care and prioritizing our actions, because those are the type of questions that belong to this category, that management of care bucket. And there's a lot in that bucket. So we want to make sure that we're comfortable doing that. And these are great questions, these types of questions, to help us even with critical thinking and outcome-oriented thinking.